Hello, my name is Dr. Mahmud and I am a GP in West London, and I'm going to talk to you a little bit about uh, strategy and how we can how we've developed some ideas in our GP practice to support innovation, a little bit about a framework that we've used which seems to be working reasonably well, and hopefully you guys can think about using that framework or yourselves, or perhaps thinking about primary care when you have your ideas. So I'm just going to share my screen. So let's hide this. And so strategy is not only what you do, but it's also what you don't do. You can't do everything. So you have to have priorities and see if you can deliver them. A little bit about me. I went to King's many years ago, and I've been a GP partner since 2004 in West London. I've had a number of roles, which include being on the board of what are now known as CCGs, and also being chair and treasurer of a GP federation. And I've had some interest in digital healthcare, as well as being a GP trainer. I've recently done an MBA at London Business School, and I am a senior clinical lecturer at Imperial. So a tiny weeny bit about primary healthcare. So it is really the poor relation of healthcare, to be honest. Often, certainly around the world, it's dominated by hospitals and secondary, tertiary care organisations. And in the UK, we are fortunate in that we do have strong primary care. But the importance of primary care in the delivery of healthcare is something that was recognised by the World Health Organization and the United Nations in Geneva in 1978. And they said that it was really important to promote the concept of primary healthcare for all countries, and to formulate the recommendations for developing primary healthcare. Not a whole heap of progress was made since then, and then they all got together again in 2018 and reiterated some of the benefits of supporting delivery of primary healthcare. And they said that we're convinced that strengthening primary healthcare is the most inclusive, effective, and efficient approach to enhancing people's physical and mental health, as well as social well-being. And it was the cornerstone of sustainable healthcare system. That being said, there are a few countries that have primary healthcare kind of, as a recognized kind of cornerstone of their healthcare service delivery. UK, maybe Cuba, maybe Singapore, but generally it is really, we're not quite there with those two UN resolutions. The biggest problem was actually, and they identified this, was the way that patients behave, but also the way that professionals behave as well. So understanding behavior in a complex healthcare system is really important. There's plenty of evidence to show that primary healthcare is very important, and it improves health outcomes, both in maternal mental health and disease areas, but also it improves the efficiency of hospitals. So, for example, if you have undergoing surgery, then you need to be fit for surgery, and you need to have support when you leave to result in better outcomes. To do that, you need to engage with primary care. One of the areas I want to emphasize in today's presentation is health equity. So there is some evidence that primary care can help reduce health inequalities, and that's not only in developing countries, but also in the US and the UK. So we all know that there's an imbalance between supply and demand. So there is less supply. Everyone's who's working primary, secondary healthcare is under an awful lot of pressure at the moment, in addition to some people having to isolate. And but actually, I think we need to think more about how we support the workforce. So how do we build a portfolio for clinicians to be able to develop areas of interest, whether it be technology or research or whatever else, as well as being able to carry out their clinical duties rather than just doing their clinical duties, um, 5 days a week or 7 days a week or whatever it may be. So the demand is increasing, and actually the only way out of this pickle is by being proactive. And there is a perception that proactive care actually increases demand. The fact is that actually, if you support patients, their knowledge, skills, and confidence, we've done some work around this, and it actually reduced demand, and it didn't take very long to do that. So just a quick outline of how we simply cannot, even pre-COVID, how we cannot continue delivering care as we are. The population is growing and is forecast to grow more, and there are more elderly patients, certainly in the UK, and the forecast is for that to increase in coming years. So that really does increase the burden, and we have to think about how we can support prevention rather than try to treat people when they are ill. There's a lot of interest and hype around technology in healthcare. I think there is a role. There's a lot of ideas and razzmatazz, but actually adoption can be quite difficult. And I think it's really important to not think of the technology first and then crowbar in that somewhere in healthcare. It's absolutely understanding what the needs are and then looking around for solutions which may help you to deliver better service. So it's got to be that way around. It seems quite simple, but it's really quite easy to come up with something fancy and say, oh, let's find somewhere to put it. Anyway, the way we work as an organization is we have to be aligned and we have to have core values. It's taken us a couple of years to get to this point. And but once you are, then suddenly lots of the strategic things kind of make sense. So the words are here are personalized care, wellness, and social responsibility, but each of those words means something specific to us that although they are all three are words that are bandied around, but for us, that we've got specific goals, and everybody has time off to work on innovation projects. So here's a little bit about who we are and what we stand for.
HIOS stands for Healthy in Your Own Skin, and that's what we're all about. We have 3 core values. Personalised care, so we want our patients to feel confident about their health and able to look after themselves with our help. We want our patients to experience a personal service just for them. And that's why we focus on more than just medicine. We look at well-being too. Which brings us on to wellness. We promote physical and mental wellness. We want you to be strong in both your body and mind, and we care about our staff's well-being too. And also social responsibility. We care about the environment and our social community, and that's why we encourage looking after the world we're living in and helping others to do that too.
Okay. Oops. That's all gone wrong now, hasn't it? Let's see. Let's get Okay, so sorry about that. Here's us, bunch of clinicians and nurses and physician associates and nurse practitioners and an eclectic group of people. The main thing is that there isn't really a hierarchy, and there's a culture of innovation, research, and teaching, and people get time off to be able to do some of those things. Back to that thing around supporting professionals' well-being. So we got the practice, which is fine. This year we've launched, well, last year actually, we've launched something called Highest Life, which is a series of webinars that we'll be running, which are predominantly designed to reduce health inequalities. So a little bit about us. We're a GP practice in West London. We're starting this new Highest Life channel, which I'll talk about it shortly. We developed a little chatbot with IBM. We're a training practice. We work with Imperial to do some research, and we've set up a Highest Helpers program, a volunteer program for patients helping other patients. Northwest London is our ICP, or healthcare organisations now working together. The usual suspects are primary care, secondary care, social services, mental health, and community services. And the idea is that everybody works together and they work on prevention. So this is the area that we kind of belong to. It's got a population of about 2.4 million people. And the way it's organized is there are clusters, and then basically integrated care partnerships are the old CCGs, or clinical commissioning groups. GP practices are pooled into primary care networks, which is about 30 to 50,000 patients. But there are big differences across each of those areas. So if you look at health inequalities across Northwest London, then different people have different priorities. So it's important that although there's an overall strategic aim, that the needs of individual areas are also supported. So the framework that I'm going to talk through is the who, what, and how. So it's really quite simple, actually. So when you think about an idea, think about, use this kind of framework. This is what we've used, and it seems to work quite well. It's shared by Professor Costas, who is a professor of strategy at London Business School. So who? So we are working on a program to deliver health inequality webinars across Northwest London for health inequality. So who is the patients that you're trying to reach? And the idea is to reach out to patients on platforms that they already use and make an emotional connection with them. So there's no technology or anything here. It's just about kind of communicating, using the language and words that people are accustomed to. This is Office of National Statistics data. Health apps account for about 15% of online activity. Social media accounts for about 75% of online activity. So instead of us developing apps and things, perhaps we should think about going to where patients are and actually speaking the language that they speak. If you look at online activity and divide that by ethnicity, then actually there's been a convergence of people having access to the internet. That wasn't the case 10, 15 years ago, but that is increasingly narrowing. And actually, if you think about what is it that causes health inequalities, actually it's things that you wouldn't perhaps think of, and perhaps things that you wouldn't think it's responsibility of healthcare to support in the first place. But actually, all of these things, all of these factors lead to increase in demand. So it's about supporting people relatively easily in ways that can make a huge difference. So parental separation has a huge adverse childhood event. So if you have an adverse childhood event, then you're more likely to have health inequalities in the future. Verbal abuse, mental illness, domestic violence, all of these things are things that perhaps we should think about supporting. And actually, if you look at a proportion of individuals and households with incomes below the minimum standard, then children with lone parents have a huge percentage of people who are below, below the minimum income standard that you'd expect. So when we're thinking about who we support, we need to think about how we identify people who are lone parents with young children, and how we support them. Again, if you look at people from the least deprived decile to the most deprived decile, then actually there's a huge difference in the results of their exam grade. So 50% versus 68%. And that gap arguably is widening with COVID. So people don't generally walk around with a sticker on their back saying they've got health inequality. So we have to look for proxy markers which suggest that somebody may be likely to have health inequalities. And free school meals is an example. This is a graph which shows correlation between health inequalities, deprivation, and free school meals. So this is some of the work done by Professor Mahmud in his report using data analysis, and hopefully we'll plan to be working with him to develop some ways of supporting that. Employment also has a huge difference to your outcome from a health perspective. So if you don't have a degree, then your job is more likely to be at risk of automation. And then also sometimes we have to be a bit careful about how we support, the sort of messages that we send to people, whether they are relevant or not. So if, for example, most deprived people were to follow the NHS Eat Well guidelines, eating healthy fruit and veg, then that would take up more than 70% of their income. So we have to kind of think about how we support people in ways that, that they can actually make a difference. And there's a huge overlap between mental health and physical health. So if you have mental health problems, you're much, much more likely to get physical health problems. So that's a little bit about the what. So the types of people that we support. So we should be thinking of how we can support children in schools. We should think about how we can support people who are working and find jobs and work experience. And then we also think about how we can support lone parents and families. So you end up, when you look at the data, it helps you identify groups of people that are not ones that you would have thought of otherwise. So typically we would come up with something like diabetes or epilepsy, but actually going through the data, understanding exactly where the problem is, and then looking to find the solution to support that is the way to kind of do it. So then you think, well, okay, well, what are we going to do? And so what we've done is you've divided into 5 sections, which again is based on Professor Marmont's report: supporting children, supporting kids and young adults, work are the 2 blue ones, and the environment. And I'll give you a flavour of some of the work that we're doing. So if one looks at the give every child the best start in life, then there are a few areas within that which identify people who are most at risk of health inequalities. So if one looks at, we'll take the first one in this case, so perinatal mental health. So if you look, the data is really quite shocking. You're supposed to be really happy when you have a baby. Actually, it's a really tough time, harder with COVID, harder when it's winter. So 50% of people have, mums have baby blues, 10% have depression and anxiety. So what we then do is analyze the information that is talked about on different social media channels. We can look at the posts, look at the impressions. We can see the individual posts, and so that we can make a connection with those people. And we can break down the results as well, looking at the demographics. For example, it's interesting that 38% are men. So when you think of perinatal mental health, you really do need to think about how you can support partners as well. If you look at the other areas of interest, humor is there, so at the bottom. So perhaps, we could think about, it doesn't all have to be really serious. It could, you need to have some balance in there. But these give you some ideas of the types of messages that we should be giving. We then also break down that data into emotions. So we try to get across the right sort of emotion. And actually, you'd expect there to be some sadness, 20%, but actually 10% are joy as well. So, it helps you to frame the type of messages and the words that you use. So identify the type of people that you want to support, and then look at the how you're going to what you're going to do for those people. And this is the how piece. So how is it you as a practice or you as an organization are going to deliver that? So we're a GP practice, we're part of a primary care network, we then belong to Hounslow and then Northwest London. So there are probably around 10 practices in our PCN, about 9 or 10. And Hounslow, there's got about 45 practices. Northwest London has about 400. So things that we come across, we can share with other people. But then we're also linked into the other organizations and people, which I mentioned earlier, across the Northwest London footprint. And we already have relationships with those people across the patch. And this is our little channel that we're doing.
Welcome to the drum roll, please. Don't be scared. HIOS live channel. What in the world, you might say? Let's face it, life has changed in the last couple of years, and the new normal is fast becoming the normal. Instead of being out and about in busy shops and busy places, we're staying at home a lot more and ordering things online. All very well when you need a pneumatic drill or something, but what about accessing services that improve your physical, mental and social well-being? At HIOS, we've teamed up with a whole load of organisations and professionals, from gardening charities, hospital consultants, schools, mental health experts, social services and many more, to bring you regular live webinars that you can tune into and out of as you want on social media and on our website, hios.org. Basically, we're bringing everything to your doorstep, but we don't want to pump out pre-recorded snooze fests so that you can get your afternoon nap in. No. We'll bring you the topics that are most relevant to you and we'll make them live, interactive, informative, and above all, fun. You'll hear from experts in their fields or gardens as may be appropriate, and you'll get to tell us what you think and what you want to hear more of. Plus, there'll even be special guests. Dum, dum, dum. Let's take a look at the schedule. Monday's Places and Spaces sessions will focus on how we can improve our well-being by using the environment and community around us. Hear from gardening, exercise and mental health experts with hints and tips on managing your health by enjoying the outside world. Wednesday's work sessions will be looking at job health, how to cope with stress, advice on career paths, money problems, making the best choices, that sort of thing. And Friday's family sessions will focus on topics for expectant parents to small children all the way up to teenagers and young adults. We'll cover topics from postnatal depression, kids' diets, to exam stress and sexual health. There's something tailor-made for everyone, but guess what? You can join any and all sessions you'd like because it's so easy. We'll let you know about what's coming up and then you can just tune in. Everything will be live on social media and also on our website. Of course, it's all free, and if you need help getting online, we can even book your session with one of our HIOS helpers who can talk you through it. So whether you can or can't tune in on the day, check out what else is waiting for you at hios.org. Oh yeah, and we forgot to say, put the kettle on, because there'll be regular sessions dedicated to simply catching up with other people. Camera off, camera on, doesn't matter. Just relax, talk about your experiences, your stories, what's going on in the news, anything you like. So spend some time with us in the afternoons. All you have to do is click. And hey, you can always catch up with the ironing in the background if you like. We won't tell anyone. Don't forget to like and subscribe to our YouTube channel too. Ta-ra!
And we're working with a whole bunch of people across the patch, and here's a few words from them.
We can't underestimate the social impact and the mental health impact of the pandemic.
What we need to do is think about how we can play our part in tackling health inequalities so that everyone has equal access to care.
That conversation with schools is really important. We have a lot of students with EAL needs that come in as immigrants. How do we get that message across to students?
Having a platform where we can engage with communities and diverse communities would help us to understand the impact and effect of some of the projects that we have come up with.
This is going to be an excellent opportunity for us to spread information and education.
We can give people information, and knowledge is power.
There's that opportunity to share experiences and just be with other people.
Oh, this is Poppy. Yeah. Gardening is really a social leveler. Anyone can do it, and it doesn't cost a huge amount to get some seeds and sow them.
Partnership working will also kind of link us up better.
This project is an amazing opportunity for us to develop our services and expand and engage with our patients in an interesting and innovative way.
It has so much need currently in the post-COVID pandemic, not just about mind, body, and soul, but also how to really look after ourselves.
Reaching out to help, and that's what you're doing, you know.
Reaching out to our entire health population to support population health. I think it's fantastic.
It really does feel like connecting with the community.
Happy to promote this programme for HIOS, who are exceptional in their work that they do.
And so the people that I just happen to know a couple of the people that you are there, that have agreed to be part of this project, and they're winners, you know what I mean? And with your enthusiasm, your dedication, I know they stayed. That's the reason why they said immediately, yes, I will help out on this, you know. And so once you have that combination of people who want to do it, the winners, it will succeed. There's absolutely no doubt about it.
I know that that's a fact.
I have to work out how this presentation works. So here it is. So I just want to wish you all a happy new year, and for us in the coming year, we're going to look at how we can work with robots and use some AR bits and pieces, but we're not going to just crowbar them in somewhere, anywhere. We're going to really think through the who, the what, and the how. And it's a great framework. So happy new year to you all, and wish you the very best in your endeavors.